It's really exciting to pick up the award. We work really hard to deliver good customer outcomes or patient outcomes, and we've done that over a long period of time. I've been here at the pharmacy now for 10 years and have developed a strong rapport with not only the patients but with the community. One of the things that we'd always thought was important was being part of the community and part of the social fabric of the community. So here in our local community of Western Creek there's 25,000 people, and we work really hard to make sure that we look after them as best we can. Not just the people that come through the doors, but also through sponsoring local sporting groups, going out to nursing homes, all of that community service. So I would attribute it to that. It is worth noting that the cancer support stuff is really important. There's a lot of patients that have got cancer and they're being diagnosed more and more early. From a men's health point of view, there's a lot of hesitancy, I suppose, from the men to talk to other people about it, particularly allied health, even their GPs. They can feel nervous and isolated and anxious. Health tends to be a women's business, and I'd like to think we're breaking down some of the barriers for the men, and that's been really important for us. We've been doing the men's health program now for 6 years, and we've seen well over 1,000 patients over that time, which I think speaks volumes about what the team does and the service that we provide. I think that really is one large element of why we've received the award, is that ability to support not just our local community here in Western Creek, but the ACT community, and even more broadly than that, with the service now reaching out into rural parts of New South Wales, down the south coast. That's helped a lot as well. Look, professional service is a bit of a buzzword at the moment, and I think there's a general lack of understanding as to what that might include, and you're really limited by your imagination. Certainly we've rolled out a number of initiatives, some have worked, some haven't, and that's normal. What I like the idea of is being able to use a framework like the CP 2025 and applying that to some of your ideas. So whether it be related to incontinence or glaucoma or men's health or cancer health, women's health, there's so many things that pharmacists see come across the dispensary workbenches every day that we're not doing enough with, and there's a lot of opportunity to implement those services in the pharmacy. Look, it's not always easy and they don't always work, but the more thought you put into it, the more you do your research, the more you talk to your team, your patients, and come up with good ideas, eventually you jag one, and when you do, it's a wonderful sense of achievement, not only for the team, but for the community, for your patients, and professionally rewarding for the pharmacist as well.